Hello, I'm Cindy Larson, President of the Muskegon Lakeshore Chamber of Commerce. Thank you for joining us today for this brief Muskegon Lakeshore COVID-19 healthcare update. With me today is Gary Allore of Mercy Health, Jerry Evans, Chief Medical Director for Region 6, Kathy Moore, Muskegon County Public Health Director, and Dr. Justin Gill of Mercy Health. Before we get started, I want to tell you that this will be brief. Everyone needs to get back to their respective locations, but they will continue to update us. If you have questions that don't get answered in this presentation, please email them to me. I will make sure they get followed up on and get those answers to you as soon as possible. Also, please keep your microphone on mute. This is just a presentation today. And as I said, we'll get any other answered questions you need later. Here's Gary.
Thank you, Cindy, and thank you so much for hosting this event this afternoon. We really appreciate the Chamber and all you do for this community. My name is Gary Allore. I have the pleasure of serving as the President for Mercy Health in Muskegon, and I'm here to just give you a few updates. And we know how important what's going on related to COVID-19 is in this community, and we want to make sure our business leaders have a good feel for what we're doing to get ready for and act upon what's already hitting our community. Before I turn it over, I'm going to quickly turn it over to Jerry Evans and Kathy Moore. But before I do that, one thing that happened last night that was amazing, and it shows the support in this community. We had all the firefighters, police, first responders show up at 7 o'clock last night and welcomed our colleagues into the organization. 7 o'clock is shift change, and we had a lot of people coming and going in this organization, and I saw a lot of tears. And our organization so supports what's going on in the community, and it's so cool to see the community support what we're doing. Before I talk about some of the things we're doing to get ready, I'm going to turn it over to Kathy Moore and Jerry Evans to talk about the Region 6 Healthcare Coalition and some community health updates. Turn it over to Jerry.
Thank you very much, Gary. I'm Jerry Evans. I'm an emergency physician here in Muskegon and also the Region 6 Medical Director for the 13-county area. Some of you may know that our state is divided up into 8 regions. Region 6 has 13 counties here in West Michigan, and our goal is to help with planning and also with response to any kind of disaster in the area. We've been in existence since 2002, and we've done a lot of planning over time. And now we're in full response mode and trying to help with this event. Region 6 is currently working with the SNS, which is the Strategic National Stockpile. We have received several shipments from that. A lot of the supplies right now are going to the east side of the state because of the needs over there. But we have had some supplies here, and we've distributed that to our agencies. So our agencies in Region 6 include hospitals, nursing homes, dialysis centers, long-term care facilities, home care agencies, and those are all folks that we work with. So if they have needs, they funnel those needs through us, and then we send those up to the state, and then as much as possible, the state is trying to meet those needs. In addition to that, we have set up some acute care sites or alternate care sites here in Muskegon and in Grand Rapids, and we're continuing to work with the state on further sites for those if needed. None of those have been opened yet, but if they are needed, they are ready for that. Other than that, I'm going to turn this over to Kathy. Kathy is with our health department, and we are working hand in hand with them from a distance.
Yes.
Thanks.
Thank you, Dr. Evans. Kathy Moore, I'm the Public Health Director for Muskegon County. First, I'd like to update you with some current numbers. We have submitted, or over 200 tests have been submitted for COVID-19 testing of Muskegon County residents. Of those, we have 18 confirmed positive results. Approximately 50 tests are pending, the results are pending, so the rest are all negative. Since our first announcement of our first positive in Muskegon County, several individuals are now approaching what the CDC defines as recovery. So we will start publishing those numbers in the very near future. I want to thank the Chamber for pulling this platform of leaders together. I know we'll have to do this again in the future, and it's just my pleasure to do so. Thanks to the healthcare leaders who work tirelessly to adapt and adjust to make sure we are maximizing our resources on the front line. I know there are a number of business leaders on the line, and I need to continue to address the importance of people staying at home and non-essential businesses allowing people to work from home whenever possible. This is really the frontline solution for what is coming. I know it is difficult to balance with the economic impact, but we need you to stay vigilant in these coming weeks. This is very important. And the biggest thanks go to those on our front line, our physicians, nurses, and healthcare support team who are in the hospitals, at the tents, changing what we do, how we do it, every day to stay aligned with CDC guidelines that help us through this pandemic. Now I'd like to ask Dr. Grill to come up and share some of the adjustments that the area is making to prepare for an upswing in the number of patients.
Thank you, Kathy. My name is Justin Grill, and it is currently my honor to serve as the Chief Medical Officer for Mercy Health here in Muskegon. And we've had some questions about, in particular, PPE, and it is true that supplies and support currently are a challenge, both here in Muskegon as well as pretty much everywhere nationally. Those of you who regularly watch the news know that to be true. As Dr. Evans noted, we are in close collaboration with all of our community partners in order to secure as much as we can in regards to supplies and make sure that our supply chain is maintained. An advantage that we have here locally right now is being part of Trinity Health, which is a national health system. And we've been able to utilize their national supply chain management to maximize the amount of supplies that we have available to us locally. One of the questions that we did receive is, do we have everything in our stockpiles that we need? And the answer to that is no. In an ideal situation, we would have much more than what we have access to right now. But we do have enough to meet the immediate needs today for our staff and our patients. One of the things that we are doing every single day is ensuring that we are following the most up-to-date CDC guidelines for the use of personal protective equipment, which is called PPE. And for those of you who are not aware, if you see pictures in the hospital or you have questions, there's actually different levels of PPE that we use for different patient encounters. If somebody is what we call a PUI, or a person under investigation, or they're positive for COVID, and we're doing routine patient care, all that's required for that is a simple surgical mask in addition to gown and gloves. The next level up, which would be an N95 mask that you've probably seen all over the news, or a PAPR, which is a helmet-like device with a face shield that comes down. Those are required during what we call aerosolizing procedures. So things such as giving someone a nebulizer breathing treatment, or actually when we're swabbing them to check to see if they're positive for COVID, those things that aerosolize the virus into the air, we have to use a higher level of PPE. And so what we're doing at the hospital is doing our best to ensure that the appropriate level of PPE is used at each encounter with the patient so that we're not wasting the higher level of PPE when it's not necessary. Our main goal at this point really is the safety of our staff as well as the safety of our patients. And right now we're able to deliver on that. The last thing that I would like to do is just thank our physicians, our nurses, and our other frontline colleagues for all the work that they're doing. I've been out in the hospital rounding. I still work clinically in the emergency department about once a week. And our staff really is doing a tremendous amount of work to keep the citizens of Muskegon County safe. And if you have an opportunity to thank them, please do that. It's a tremendous amount of work. They're putting themselves at risk every day. And then those of us who have families to go home to, you realize that they're at risk because we're at risk. And it's something that I think a lot of us realize when we go into medicine or we go into nursing, that there's going to be risks to us, but in this case, there's also risks to our families. And so it's a true burden for our staff right now. So if you have an opportunity to thank them, please do. They're doing a fantastic job, and they deserve all the thanks we can give them. I'd like to call Gary back up for a few more comments.
Thank you, Justin. And I too always have to thank the colleagues at Mercy Health Muskegon. We have an amazing medical staff. Our nurses and frontline colleagues that are taking care of patients today are doing an amazing job. And they continue to partner to get creative about how to preserve PPE at the same time we're making sure that we're staying safe. And the safety of our colleagues and the patients that are coming into our organization are the most important thing to us right now. So one of the big questions I always get, and I want to just do a quick update on how are we prepared for if we do see a surge like we're seeing across the country. So Mercy Health Muskegon, we're in a pretty good place. related to facilities. So as you all know, we were planning and still are planning to consolidate all the inpatient beds to the Mercy campus in the fall. Well, we still have excess beds today. So one of the things we've been able to do to prepare for this is we got an emergency CON certificate of need request approved to be able to open our 10th floor and our 4th floor at our new medical center. So today we have our COVID and PUIs, persons under investigation, as Dr. Grill mentioned. We're hosting those patients today on the 6th floor of the new medical center. And we have the ability now to ramp up into the 10th floor, which wasn't being used, the 4th floor, which wasn't being used. That's an additional 50 beds that will give us a lot of growth capacity if we do see an influx. In addition to that, as Dr. Evans was mentioning, we've been partnering with Muskegon Community College, thank you Dale Nesberry, and Region 6 Coalition to actually, it's already set up to be able to have 50 beds out at the Wellness Center at Muskegon Community College. So puts us in a really good shape, a good place in the community to be able to ramp up. That's 100 beds very quickly that we could ramp up, in addition to the capacity we already have on the Mercy campus. So we feel like from a physical perspective, we're in really good shape. Got a question about staffing that I'll address in a minute. The other thing that happened last week that was important to us is a big part of understanding what's going on in the community is access to testing. And we were able to get a new testing lab starting last Friday in Grand Rapids that they're now turning around tests in about 24 hours. We were waiting 5 to 7 days sometimes to find out if a patient was negative or positive, which was kind of bogging down the system. We are getting those tests back quickly now, and that's helped us significantly. So appreciate that. Another nice thing is we continue to partner with our community college, Muskegon Community College and Baker College. They have medical they have medical programs, especially the nurses training programs, that they want to allow the nurses there that are training to be RNs to help in any way they can. So from a support staffing perspective, our ability to access that nursing staff is going to be huge to us as we start to ramp up. As it stands today, as I mentioned, we're using the 30-bed unit, and that unit's about half full right now. So we haven't seen a huge surge in Muskegon, but we're continuing to watch what's going on across the country, and we know that it's coming our way. We feel like that we are ready for the surge, and as Dr. Grill mentioned, protective equipment is something that there's a shortage nationally. We're fortunate to be part of a big system in Trinity Health where they do have a world-class supply chain department that has access, and we are looking for any leads we get about gloves and masks. We're trying to take that lead, source it up to Trinity, and try to get everything we can. So we're doing our best from that perspective. We're okay today, but it's going to be a day-to-day thing because we know that there's more need in the southeast side of the state right now than there is in West Michigan. So I'm gonna look at some of the questions that came out from the business community earlier today. So one of the questions which I mentioned was, do you have enough staff to support the ramp up of the facilities you're going to have as the COVID-19 hits Muskegon County? So the staff answer is it's kind of is the answer. We at this point we are in good shape on the 6th floor. Our nursing team is doing a great job trying to figure out how to get creative on staffing as we ramp up. We know that if we get to the point where we have to use all 50 additional beds on the Mercy campus and move to the community college space, that we will not have enough staff to do that in the current staffing models. But our team is getting really creative about how we're going to be able to use different providers to do things like use CRNAs to do anesthesia monitoring and use med-surg nurses with a kind of an ICU quarterback to help take on more patients. We have got to get creative because we know that ICU nurses and respiratory therapists are two categories that are hard to come by. And if you listen to any newscast, it's happening all over the country. So our teams are getting creative. We feel like we have the staff to support the surge plan today, but it's going to look a little different than the model today. But it continues to evolve every day, and we're watching the numbers across the country and across the state. So it helps us plan for what we need to do. Then the next question was, what about employees who are not involved in direct care? That's a great question, and that's something that I believe the world in general doesn't realize, that at the same time we're planning for this huge pandemic that's coming our way, the majority of our core business is really pretty idle right now. So it's hard to believe that a healthcare system like Mercy Muskegon, we're about 70% outpatient. And the outpatient side of our business right now is we're not doing elective surgeries. We're keeping people out of the hospital so we can prepare for this. But so we have a lot of staff that are very slow because of there's just not volume to take care of. At the same time, we're trying to redeploy and ramp up for the COVID patients that are coming our way. So we are adjusting our staffing every day to the volume that's coming in the organization, as all of you are in your business community. We continue to do that. We are pleased with some of the new federal programs that just came out of the federal plan that just got approved. So we're looking at getting a little more structured in Muskegon also with how to make sure that we can get our staff that don't have work today the structured program to be able to get into some of the federal plans. So we're working on some of that today, actually, and trying to work through that as an organization. So we staff where we need it, we ramp up where we need it, and we try to adjust as best we can so the viability of our health system long-term stays very, very strong as it is today. So next question is, some of the modeling in Detroit and Grand Rapids has been shared. Do you see, are you looking at that to see how it's going to impact Muskegon? That's basically the question. So there's a lot of modeling going on across the country, and we're watching it in Detroit, and it's amazing what's happened in the last week. The facilities are connected to Mercy. All the Trinity sites in Detroit are filling up very quickly. We're fortunate that in Grand Rapids and Muskegon at this point, we haven't seen the surge, but we're watching the modeling tools to see how, when you get your first few patients, how quickly that volume doubles and then doubles again. But we're watching the modeling. We adjust it every day, and we're trying to plan for when we'll see the surge in Muskegon. The single biggest thing that impacts what's going to happen from a modeling perspective is social distancing. If you look at any of these models, if we do a good job in our community at social distancing, we will bend the curve with that modifier in this tool more than anything. So that's one of the things that we just try to encourage people to continue to do that work. We're also fortunate that, as you've seen in other large communities across the country, you've got states where you've got a hub of dense population, and the other side of the state, you've got a not quite as dense population, and the numbers are very different. In Muskegon, we're very much hoping the numbers can be different, but we're planning for the surge that could likely come our way. Let's see, the next and last question that we received was, what can we as a business community do to support us? And I'll just say that we've seen that it's been amazing. Our philanthropy department in Muskegon is taking all the calls from our community leaders and individuals in our community. That the amount of the donations that we've received, both financially, supplies, people offering to sew, it's just amazing the support that we continue to get at Mercy Health Muskegon. It feels really good to be a large employer in this community, and when we need the support, we are absolutely getting it. So, but I would say right now, the biggest thing you can do from a support perspective is you can all encourage and model the behavior that we need to see in this community. We really need people to stay home, stay safe, stay healthy, hang out with your families, enjoy each other's company right now, but we need to do that. The social distancing, like I said, the social distancing piece of the equation, if we can do that very well in Muskegon, that's the single biggest thing that will help bend this curve and get us through the next few months. So just want to say that we really appreciate the business community. We hope this has been helpful in just updating you on what's going on at Mercy Health Muskegon right now. And we will continue to take the questions that come in from you all, and we'll continue to do these updates because we want the community to know what's going on at Mercy Health Muskegon. We feel prepared, but we know that we've got a lot of work to do. So thank you all for participating today.